1 out of every 5 healthcare dollars is spent caring for someone with diabetes. In 2007, diabetes accounted for 15 million workdays absent in the United States. In 2005, cardiovascular disease cost Pennsylvania an estimated $15.7 billion in healthcare costs and lost productivity. According to a recent RAND study, only about half of patients with chronic illness get the recommended standard of care. Health literacy is also a significant barrier, with up to 50% of people unable to understand written instructions related to their condition. Healthcare is a national problem, but it is delivered locally, and fixing it requires local action. Why can't we be the healthiest community in the United States?
We can do better.
We can get you involved with Aligning Forces for Quality, South Central Pennsylvania.
November 2004, I was actually diagnosed at that time with cardiac heart failure. And I was diagnosed with diabetes in 2007. I had a brand new mortgage on a house and everything. And facing the fact that my son needed a lot of help and somebody to be with him, for him to grow up to be independent. It was a lot of fear. I was in the blind.
There are no physical signs that you're aware of unless you're educated about diabetes. I was afraid because I had no idea what the feel of diabetes was.
To explain to the patient what's going on with them, how critical it is that they are engaged in their care, how to understand their disease, and then have them encouraged to ask questions to make sure they understand everything has really been a challenge.
Health literacy is a multifaceted issue. It is as much about the way a doctor communicates with the patient as it is about information, printed information, patient education materials that are developed, signage in an office to explain how to get there.
Employees that come to us and come to work that have a chronic health condition who are either not taking their meds or visiting their doctor or just practicing good healthy lifestyles oftentimes can increase the absenteeism.
Everyone who gets care, gives care, and pays for care must work together. Whether it affects your parent, your spouse, your employees, or your patients, chronic diseases are hurting all of us and impacting our community. We can take action together. Aligning Forces for Quality, South Central Pennsylvania is leading change in our community.
The Robert Wood Johnson Foundation created Aligning Forces for Quality, or AF4Q as some folks call it, to bring together all of the different initiatives around improving the quality of chronic disease care under one big collaborative partnership. They bring together health plans, healthcare organizations and providers, employers and businesses, and consumers of care.
We are working with different practices who have come forth and volunteered to be able to help with advancing planned care in the practices itself. Through this process, it's established high goals to which we're trying to meet with the different practices on achieving certain curriculum. We're looking at having an impact on future health conditions of patients, and we're trying to reduce the amount of patients who will show up in the hospital ED department for medical concerns that are related to diabetes. And if we can reduce that amount, we can be more efficient overall and try to get in line with the healthcare system that's coming around. It's helping to have an open communication and dialogue and breaking the silos down to where these practices are communicating and sharing ideas side by side, and that impact is tremendous.
If one organization is doing something really well, why not share that? Go ahead and make that contact. What we have found that through Aligning Forces, which is really kind of neat, is the frontline nurses really do not see the walls of an organization. Their focus is really on the patient. They understand that, and they're willing to share information.
The Physician Clinician Learning Network is a space, a meeting time for practicing physicians to get together to learn about something that's important to them, that's important about improving quality, and also allows a time for them to be able to share with each other what's working in each other's practices and what isn't.
We can, as doctors, partner with our patients.
We can help patients to make a wise decision about their health care by talking to them in plain language.
We can ensure that everyone in our community has access to barrier-free, high-quality health care.
And one of the things that we did was develop a tool that helps patients know whether they're in trouble, if they're starting to get in trouble with their heart failure. They weigh themselves daily, they record it, and according to their weight, they know whether they are in the red, yellow, or green zone. We call it the Heart Failure Zone tool. And through Aligning Forces for Quality, we were able to take that tool and publish it, and it is now used community-wide. It doesn't matter what healthcare organization you are. If you're an independent physician, the home health agencies, it's available to anyone in the community, and we're seeing patients coming in who have received that tool from all different places. It didn't start out as an Aligning Forces for Quality goal, but because of the support of AF4Q, we were able to get it community-wide.
Aligning Forces for Quality is working with South Central Preferred because of our experience in measuring quality in the community and our experience in reporting measurement back to physicians of their quality results. And starting approximately 3 years ago, we started taking that quality data and reconfiguring it so it could be reported publicly through Aligning Forces for Quality. And what this does is to give lay people an opportunity to see what are the appropriate quality measures that the health system is being measured by and providers are being measured by. And number two, what should be their expectation in looking for physicians or practices that would deliver to them the best quality care.
This year alone, more than 2,000 people have visited the website to review data. We have heard stories from both patients and doctors showing that we can use the data to improve healthcare.
I went back to the website probably a week or so ago because I had my annual physical and my lab work came back with high cholesterol. And I remembered on the website seeing something about LDL, didn't really know what it meant. I asked my provider what my number was because I knew there was some kind of a measurement on the website. So then I went back to the website and saw that yes, in fact, my LDL was not as good as it should be, and also that my provider is really good at getting that condition under control. So it was useful to me.
The ICANN Challenge is a 12-week step-by-step program to improve your health that we originally launched in May of 2009. With our first trial run, the participants were able to complete the challenge by following with our coverage on Fox 43 and using the online materials. And the program includes anything from learning portion control to how to talk to your doctor about your medical conditions to increasing your physical activity. So it really is a program designed to be a holistic approach to improving your health.
There was no complicated routine that we had to follow. We didn't have to count calories. We learned to separate our portions. One of my goals was to try and get my blood pressure down, and what the plan did was got me back to eating a little healthier, and I went back to exercising. We really had a lot of fun, you know, and it was great to be able to do that with a group of people other than just doing it by yourself.
When the ICANN Challenge came about, the other thing we did is started to share the material within the workplace. But we also wanted to get people in the office to know, well, have you heard about this? Why don't you watch Fox? Why don't you learn?
There was an online version that allowed many members of the community, over 200 folks were able to join us and move along with our contestants on a journey to better health. Overall, what we saw from people is improved health conditions based on their own choices and management of their chronic illness.
We can improve the quality of our life.
We can work together to get healthy.
We can, as patients, use the AF4Q website to learn what questions to ask our providers about our condition.
Those who've committed to support AF4Q have made a difference.
Aligning Forces for Quality is unique in that it brings together the people who provide care, who pay for care, and who receive care. Maybe allows more to get done because all the players at the table are there.
I think for our business, it has brought us additional information, some new tools, and guidance that we can provide to our employees. It's something that really is established that several of the local employers have already taken advantage of, and I would encourage others to take a look at.
There are inequities in the health care that's provided in our community. And that's what we're really working hard to try to rectify, and Aligning Forces is helping us, providing us with tools to help us do that work.
The ICANN Challenge actually brought all the tools that I needed to know more about my disease, how to control it, and how to take care of myself. The infraction of my heart at the time when I started the ICANN Challenge was at a 12%. With exercise and everything I learned from the ICANN Challenge, I could gladly say right now the output of my heart is at a 34%. It gave me a brand new style of living. It has added years to my life.
I've learned to eat properly about portion size. And when they showed me that from the ICANN Challenge, it was so simple when they said, well, sure, you can have a piece of red meat, but it has to be the size of a deck of cards. And if you have some kind of support, you are going to make it. You will make it.
We can together be more powerful than any one of us alone.
There's a seat for everyone. There's a role for everyone.
It takes everyone to improve the system, because in the end, you're going to at some time be a user of healthcare. You can email, you can call our office, and we will connect you to individuals that can get you started on the work that we're trying to do to improve quality in this community.
We can be part of the change.
We can help our employees lead healthier lifestyles.
We can do this together. We can.